Good morning. I want to take a moment to thank our partners here today. First of all, Jason Barnett-Kearns, who is the President and CEO of Trillium Health and a wonderful partner, a dear friend. I'm grateful to him for hosting us today and for his willingness to speak out on what we have seen happen in the last month or so in Washington. I want to thank Rory Dumas, whose willingness to speak out and share his story, which is very powerful. And Rory, I've been with a couple of different times at press events, so really appreciate your adding your lived experience to our conversation. Just a few weeks ago, congressional Republicans passed the most harmful piece of legislation to come before Congress in generations. Donald Trump is kicking more than 15 million people off their health insurance to give tax breaks to his billionaire friends. This is a betrayal of working people in Rochester and around the country. Trillium and health centers like Trillium are central to Medicare medical care for Rochester families, and so grateful for all they do every single day. Extraordinary organization. But President Trump has callously made their future uncertain. But the consequences, which honestly I don't think the president even cares about, he expects the people of Rochester to pay for the price for his corruption. And I'm not going to, nor are many other members of Congress going to let it stand. The bill, just as a reminder, cuts $900 billion in Medicaid funding, the largest cut in American history. And it threatens the health care coverage of 15 million Americans. It raises health insurance premiums for those who will still be fortunate enough to have health insurance after these cuts, and provides tax breaks to millionaires and billionaires. In fact, when you look at it, the whole plan is premised on the idea that the wealthiest Americans deserve a pay cut and a tax break. So the only way to do that is to take it out of the health care and the nutrition assistance of millions of poor and working class Americans. It is the greatest example of reverse Robin Hood thinking in our nation's history, and it doesn't have to be this way. Making high quality, affordable health care available to everyone is a goal that I have worked for, that the people here at Trillium have worked for. As a state legislator, several years ago, I was charged as the chairman of the insurance committee at that time for implementing the Affordable Care Act, which was providing health care coverage for families who needed it the most, and providing modest subsidies for those who couldn't afford commercial insurance. In Congress, I voted to lower the cost of prescription drugs for people on Medicare, and urged that we extend that beyond just Medicare to all Americans. We pay some of the highest amounts for prescription drugs any industrialized country in the world. And the work we've done has changed lives. This legislation, the big ugly, is not the way to do what we want to do. As I said, it's a reverse Robin Hood, stealing from the poorest and disadvantaged Americans to give handouts to the wealthy and the elite, and the impacts will hit hard. And you'll feel it in places like Trillium here, which has not only continued to serve this community in so many ways, continues to grow in its impact and influence in the Rochester community. But people will get sick now. People without access to physicians and primary care providers who they know and trust. And what we'll be doing is instead, people will get sick. Whether you have health insurance or not, you still get sick. And so what do? Instead of being able to go to a primary care provider, you'll get sicker and sicker, and then eventually you'll end up in an emergency room with symptoms and with illness that is far more acute, far harder to treat, far more dangerous, and it's going to fill up emergency rooms that are already taxed to their limit. And so this affects everyone, whether you're on Medicaid or Medicare or you have commercial insurance. Doesn't matter, you'll all be impacted when anyone shows up in an emergency room. They don't call out and say, who has commercial insurance, we'd like to treat you first, or who has Medicare, we'll take care of you first. They take care of people who are sickest. And so everyone will wait. Everyone will spend hours and hours and hours by emergency rooms and healthcare systems that are already overtaxed. I've lived through illness in my family. At the end of my father's life, my mother's life, my daughter Lauren's life, we were able to receive incredible care at local healthcare systems. I simply cannot stand the thought of losing anyone because who we cared for, because the president wants to give handouts to rich friends, and there isn't health care enough to go around for every American. So we're going to continue to fight back. I'm a co-sponsor of legislation to protect programs like Medicare and Medicaid. We're going to continue to demand specific answers and implementation questions from administration officials. And we're going to use congressional oversight and lawsuits wherever possible filed by partner organizations to stop the administration dead in its tracks. And here at home, I'm going to continue to speak out and join efforts with organizations like Trillium. The fight is not going to be easy, but the people of Rochester deserve a world where they can get the care they need when they need it, whether it's for a cold or more extreme cases like people who have cancer or HIV. You deserve to know getting surgery or emergency care in your 20s won't leave you with a life full of medical debt. You deserve better. You deserve to have a system that's fighting for you, not a system that's fighting against you. And with that, I want to turn it over to a wonderful partner, a dear friend, and someone who leads this organization with great distinction, Jason Barton, Kearns, President and CEO of Trillium Health.
Trillium Health is a community health center dedicated to providing compassionate, judgment-free, and affordable care to everyone in the greater Rochester community. Community health centers like ours are the backbone of the nation's safety net. Since their inception, community health centers and Medicaid have worked hand in hand to ensure that low-income and vulnerable communities can access that high-quality, affordable care. But unfortunately, both Medicaid and community health centers are facing serious threats. On July 4th, President Trump signed H.R. 1 into law, a sweeping bill that drastically alters Medicaid and threatens how millions of Americans access health care. The federal changes will have a direct impact on community health centers across the country. At Trillium Health, 40% of our patients, about 5,600 individuals, are covered by Medicaid. We anticipate that many of our patients will lose their health insurance due to Medicaid work requirements or becoming ineligible for the essential plan, resulting in an estimated $1 million loss in annual revenue. Beyond the financial impact, our administrative burden will increase significantly. Community health centers are resilient. We faced many challenges before, and we've endured. We are grateful to our federal partners, including Congressman Joe Morelle, who has fought tirelessly for safety net providers and the vulnerable populations we serve. We will stay closely connected with our representatives in Washington. We will adapt as necessary, and we will keep advocating for the funding that we need to fulfill our mission. We need thoughtful, common sense solutions to ensure that everyone in our community can access high quality healthcare, regardless of their ability to pay. Thank you.
Thank you, Jason. Now let me ask Rory Dumas, who's both a patient and an advocate, to share his story.
Several years ago, I had a job that closed down, and I needed health care, and I qualified for Medicaid, which I was very grateful for at the time. I've been a patient at Trillium for a lot of years, and it's been exemplary care here, always. Medicaid actually helps me maintain. As I get older, things are starting to fall apart, and I've been able to get the best care I can get because of Medicaid and Trillium Health. They send me where I need to go. They make sure I have all the shots I need. They make sure I have all the meds I need. It's a great place. I can't imagine if I hadn't had Medicaid, how I would have all this stuff. I really don't understand the bill that's trying to take this away or make people work for it. It doesn't make sense to me that people potentially are going to get sick and die because the government wants to play games with people. I don't know. I thank everybody here and for what they do for me.
You know, and I think just to close again, it's so hard to imagine in America that we would be in a place where we want to reward the wealthiest Americans by hurting the poorest Americans, those who struggle, those who are trying to get back on their feet, those who are trying to deal with the real challenges of life. And the interesting thing is, in addition, we want to give benefits to the wealthy so much that not only when these cuts aren't enough, we're going to borrow another $3.5 trillion to add to the national debt, all in service of tax cuts to the very wealthy. It is not only un-American, it is immoral. Thank you all. Thank you again, Jason, for the extraordinary work that Trillium does day in and day out. Rory, thanks for sharing your story. We'll continue to keep you in our thoughts, and thank you all. God bless.